Ever pondered about the delicate balance of life and how a single organ, the heart, plays such a crucial role in it? Or how a failure of this organ can lead to dire consequences and the necessity of medications to manage it? This, dear friends, is the enigma of heart failure and the importance of its medications. First, we delve into the world of ACE inhibitors. What do names like enalapril and lisinopril remind you of? Yes, they belong to this class. ACE inhibitors act by blocking the conversion of angiotensin I to angiotensin II, reducing blood pressure and the heart's workload. Side effects can include a persistent dry cough, dizziness, and fatigue. Patients with a history of angioedema or bilateral renal artery stenosis should avoid this class of drugs. Next on the list, we find the beta blockers. Metoprolol and carvedilol fit perfectly into this category. They work by blocking the effects of the hormone adrenaline, also known as epinephrine, reducing the heart's tendency to beat faster. Side effects can range from fatigue, cold hands and feet, to potentially serious ones like slow heartbeat and shortness of breath. Asthmatic patients or those with serious heart conditions such as heart block should steer clear of beta blockers. Moving on, we encounter angiotensin II receptor blockers, or ARBs. Losartan and valsartan are examples of this class. They prevent angiotensin II from binding to its receptors, thus relaxing blood vessels and reducing the heart's workload. Side effects include dizziness and high potassium levels. Similar to ACE inhibitors, those with bilateral renal artery stenosis should avoid ARBs. Diuretics, commonly known as water pills, are next in line. Furosemide and hydrochlorothiazide fall under this class. By increasing the excretion of water and salt from the body, they decrease the volume of fluid flowing through the heart. However, they can lead to increased urination, electrolyte abnormalities, and dehydration. Diuretics are contraindicated in patients with severe kidney disease or those allergic to sulfonamides. Lastly, we have the aldosterone antagonists, with spironolactone and eplerenone as examples. They work by blocking the action of aldosterone, a hormone that can cause fluid retention, thus reducing the load on the heart. Side effects can include high potassium levels and gynecomastia in men. Patients with high potassium levels or severe kidney disease should avoid this class of drugs. To summarize, the 5 classes of drugs for heart failure each have their unique roles and mechanisms. ACE inhibitors and ARBs work on the renin-angiotensin system. Beta blockers inhibit the effects of adrenaline, diuretics help shed excess fluid, and aldosterone antagonists block the action of aldosterone. Each class has its potential side effects and contraindications, underscoring the importance of individualized treatment plans for heart failure patients. Remember, the heart is a vital organ, and managing its failure requires careful consideration. Medications can help, but they are only one part of a comprehensive management plan. Stay healthy, stay informed, and take care of that heart.